All right, guys, welcome back to Underground Science. In this video, we'll be talking about tricuspid regurgitation. All right, so let's go and get started. So I tried to draw a picture of the heart right here. And so this disease, right, tricuspid regurgitation, as it says in the name, the problem is going to be in the tricuspid valve. Okay, so this right here is the tricuspid valve. Okay, it's the gateway, right, for blood to go from the right atrium to the right ventricle. All right. So that's the main job of the tricuspid valve is to let blood go from the right atrium to the right ventricle. And also another job of the tricuspid valve is to not let blood go from the right ventricle back to the right atrium when the right ventricle contracts and pushes blood forward into the pulmonary artery, right? So those are the two main jobs of the tricuspid valve. Okay. So now that we know that, what is tricuspid regurgitation? Okay, so tricuspid regurgitation is when blood regurgitates, right, or goes backwards. So blood from the right ventricle goes backwards to the right atrium when the right ventricle contracts, right? What did we say? We said when the right ventricle contracts, the blood's supposed to go to the pulmonary artery. And no blood is supposed to go backwards, right, to the right atrium. But if you have tricuspid regurgitation, then some blood will go backwards to the right atrium when the right ventricle contracts, right? For whatever reason. Okay. So basically, tricuspid regurgitation is when your right ventricle contracts and your tricuspid valves don't shut close. They don't shut completely. Okay. And if you don't shut completely and you remain slightly open, right, then blood has space to go backwards into the right atrium. All right. So why is that bad, right? So over time, if the right ventricle, right, every time it contracts, you keep on pushing blood back to the right atrium, then you can imagine that over time, right, the pressure in the right atrium can increase, right? So over time, the right atrial pressure, right, can increase. And of repeated, because the right atrium repeatedly accepts blood, right, from the right ventricle, every time the right ventricle contracts, it would make sense to say that that can lead to dilation of the right atrium. Okay, that can lead to right atrial dilation, and that's not good because, as we know, if your atria dilate, right, that can irritate the electrical system of the heart, and that could increase your chances of arrhythmias, right? Like AFib, for example. Okay, so that's why atrial dilation isn't a good thing here. All right, because the right atrium's repeatedly getting extra volume, right? Every time the right ventricle contracts, your tricuspid valves don't close fully, so blood squeezes back to the right atrium, right? Shoots back up to the right atrium. And if you repeatedly accept that extra volume of blood, your right atrium's going to want to dilate, right? Because it's always accepting extra blood from the right ventricle. So it's going to want to dilate, right? So it can have more space. And so what happens is, right, not only is it the fault of the tricuspid valve, the right ventricle can also be at fault here, right? If you imagine, if the right ventricle dilates, right, let's draw a separate, simple heart picture right here, right? And this is going to be the right atrium, right ventricle, tricuspid valve, right? Let's say that we simply draw the tricuspid valve as a cylinder, right? Let's just say in this case. Now I draw another picture here, right? And I draw something like this, right? Let's say it's something like this, where now you can see the right ventricle is much bigger, right? Let's say all of this is the right ventricle only. If the right ventricle dilates for whatever reason, right? Then initially, if the tricuspid valve was this big, right? And if the right ventricle dilates, then you can imagine that the tricuspid valve, right? So if we drew the valve leaflets in this case, like this, right? If you can imagine it's like that. But if the right ventricle gets way bigger, then you can imagine these leaflets spreading apart too, right? So then it's going to transition to something like that, right? So every time the right ventricle contracts, the dilated right ventricle, right, the tricuspid valve will not snap shut fully. Okay, and that's going to again leave space for blood to go back into the right atrium, right? So that could be another reason for tricuspid regurgitation. And you can imagine why this can be bad is because usually what does the right ventricle do? It pumps deoxygenated blood, right, to the lungs so that that blood can get oxygenated, then go to your left atrium, left ventricle, and then to your body, right? So your organs can get oxygenated blood, proper perfusion, right? But if your right ventricle, if you have tricuspid regurgitation, every time your right ventricle pumps that volume of blood, some of that volume keeps on going back to your right atrium and doesn't make it to your lungs, right? That's going to decrease the amount of oxygen delivery to your tissues, right? So that can be bad. Okay. So the next important thing will be to talk about murmurs, right? So what murmurs will you hear? So the type of murmur that you're going to hear is going to be a holosystolic, high-pitched, blowing murmur, okay? Let's go and write that down. So if we draw our little S1, S2 graph, right? So we draw that and we say this is S1, this is S2. As we know, between S1 and S2 is systole, between S2 and S1, right, is diastole. So this part is systole, and then between S2 and the next S1 is going to be diastole, right? So during systole, right, what holosystolic means is that during the whole systole, you're going to hear that murmur. Okay, during the entire systole, the murmur will be present. All right. So you'll see something familiar, right? These heart sound graphs, you're going to see something like this, where you'll have this murmur occurring throughout the entire systole. All right. And that's because throughout the whole systole, as the right ventricle is contracting, right, it's the pressure in the right ventricle is going to be higher than the pressure in the right atrium, right, during systole. So that means that if the pressure in the right ventricle is higher, where do things like to move? High to low pressure, right? So if the pressure in the right ventricle is always higher than the right atrium during systole, then blood will want to move to the right atrium, right? And if your tricuspid valve doesn't close properly, right, then blood will move to the right atrium throughout the whole systole, right? Because throughout the whole systole, the pressure in your right ventricle is greater than the pressure in your right atrium. Okay, so throughout the whole systole, you're going to hear that regurgitation, turbulent blood flow moving from the right ventricle to the right atrium, right? That's what's going to cause that murmur that you hear. Okay, and it's why is it high pitched, right? Because anytime you have a regurgitation murmur, right? So this is going to be a regurgitation murmur. Anytime you have a regurgitation murmur, you can, especially in this case, right? This is going to be a regurgitation murmur, right? That's what tricuspid regurgitation is. So that means that you're going to have a high velocity, turbulent blood flow, right? High velocity, turbulent blood flow. And if something's high velocity like that, right, you can expect it to be high pitched, right? Because because you're going to have turbulent blood flow. That's the main cause of why you would hear a murmur, right? So you're going to have turbulent blood flow and it's going to be high velocity, okay? It's going to be a high velocity jet, right? Turbulent jet that flows from the right ventricle to the right atrium when the ventricles contract, all right? And that's what's going to cause that whooshing sound, and that's why you call it a blowing murmur, right? Because it's going backwards into the right atrium. Okay, it's regurgitating backwards into the right atrium. All right, so the only question is, well, where will I hear this the best when I'm auscultating heart sounds, right? And it's going to be in your left lower parasternal border, right? And why is that? Because if we remember, right, your left fourth intercostal space, right, parasternal border is where you would auscultate to hear what valve? Your tricuspid valve, right? So that's why at that spot it would be best to hear the tricuspid valve regurgitation, right, at that spot, because that's where you would auscultate in order to hear how the tricuspid valve is sounding. Okay. So that's the murmur part of tricuspid valve regurgitation. And now let's talk about maneuvers. Okay, so let's talk about maneuvers real quick, okay? Because the main thing to know here, right, is inspiration, right? What will inspiration lead to? So, inspiration, as we know, right, if you take a deep breath in, what do? Right? You decrease intrathoracic pressure, right? What does that mean? Right? If you decrease the intrathoracic pressure, right, the pressure in your thoracic cavity, blood will want to go there, right? Because things like to go from high to low pressure. If you decrease the pressure in your intrathoracic cavity, blood will want to go there. So that means more blood, right, will enter your heart, specifically your right side of your heart. So if more blood is going to the right side of your heart, that means more blood will eventually end up in your right ventricle, right? So now your right ventricle has a lot more blood. But your tricuspid valve is incompetent, right? It cannot close properly. That's why we have tricuspid valve regurgitation. But then on top of that, you give your right ventricle way more blood than usual. So when your right ventricle then goes to contract, it's going to push more blood than usual back up to your right atrium because of the incompetent tricuspid valve. So that means your murmur will then be louder. Okay. During inspiration, you'll hear a louder murmur, specifically in relation to your tricuspid valve, right? If you're auscultating heart sounds and you're listening for tricuspid valve regurgitation at the left lower sternal border, you're going to hear a louder murmur on inspiration. What is this called? This is called Carvalho sign. All right. Okay, so that's important to keep in mind. All right, right-sided murmurs increase with inspiration. Okay, so that's Carvalho sign. That's important to keep in mind. All right. And so then we can talk about further findings, specifically, right? What you would see in the neck and then in your organs like your liver. All right. So if you have tricuspid valve regurgitation, right, then blood is gonna backflow, right? So if we drew a quick picture right here like this. Okay. So we said we have tricuspid valve regurgitation. Every time the right ventricle contracts, you're pushing some volume of blood into your right atrium. Eventually, that blood, right, if you're constantly pushing blood every time into your right atrium, then blood will start to backflow, right? So that means that if we take the inferior vena cava, right, for example, then because we know that the inferior vena cava and the superior vena cava, right, dump into the right atrium, right? So the superior vena cava dumps here and the inferior vena cava dumps here, right? If blood starts to backflow, then it's just going to go back where it came from, right? So if blood goes back to the inferior vena cava and downwards, right, the liver eventually drains here, right, to the inferior vena cava via the hepatic veins. So if blood goes into your liver, right, if blood backflows into your liver, you're going to have a congested liver and that can enlarge your liver. So something we can see is hepatomegaly, right? And then that can lead to right upper quadrant discomfort, okay? And then we can also see ascites, right? And edema, right? Peripheral and pedal edema, okay? Because blood will just keep on backflowing until it gets to your limbs, right? Your lower limbs. And because of that extra hydrostatic pressure, fluid can leak out and cause pedal edema and ascites. Okay, so this is right-sided backup. And the same thing can happen. Like you can also see if the blood backflows into the superior vena cava and eventually to your jugular veins, you can see jugular venous distension, right? So that's another finding that we should keep in mind too. And so now that we know the main things, right? The main aspects of tricuspid regurgitation. The only question that we should have now is like, okay, so what are the causes then, right, of tricuspid regurgitation? Why would this ever happen? So the first cause that we can talk about, right, is going to be right ventricular dilation. Okay. So the tricuspid valve can be normal, right? It can work fine. But if you dilate the right ventricle, like we talked about before, that's going to separate the leaflets apart also of the tricuspid valve and then lead to the leaflets not being able to close properly when the right ventricle contracts, therefore leading to blood backflowing into the right atrium when the right ventricle contracts, right? So again, if we drew that real quick, remember, right, if the leaflets look like this, right, normally, and then for some reason, right, which we'll talk about soon, your right ventricle dilates, right? So now if we draw something like this, right, and your right ventricle dilates a lot, right, then your leaflets will spread apart too, right? So then you'll get something like this. And so now when the leaflets go to close, right, it won't be able to close completely. And so blood will backflow, and that'll be tricuspid regurgitation, right? So that can be one cause. Okay, right ventricle dilation leads to annular dilation, right? The leaflets don't co-opt together properly, and then that could lead to backflow of blood. So now the question is, okay, right ventricular dilation makes sense as a cause, but what causes right ventricular dilation, right ventricular dilation? So one main cause that we can keep in mind is going to be pulmonary hypertension, right? So we can imagine that if the right ventricle pumps blood into the pulmonary artery, right, which goes to the lungs, gets oxygenated, and goes back to the left side of the heart, right? So if your pulmonary artery or the blood vessels in your lungs are vasoconstricted, then that's going to increase the resistance, right, in your lungs. So that's going to mean your right ventricle now has to work extra hard to pump blood into the lungs, which means it's going to try to hypertrophy. And soon, right, it can only hypertrophy enough. And if it works too hard and hypertrophies, works hard, hypertrophies over and over again, right, later on, what that can lead to is dilation of the right ventricle, right? And it can get weak and dilated. Okay, so that's one cause. That's pulmonary hypertension, right? That's basically hypertrophy, which then leads to dilation. Okay. Why is it going to hypertrophy? Because it needs to work harder to pump against a higher resistance in the lungs, right? Because the pulmonary artery is vasoconstricted for some reason, which is going to increase the pressure in the lungs, right? So that means the right ventricle will have to contract harder and work harder to push blood into the lungs, which is a high resistance which is a high resistance environment in this case, right? So that's pulmonary hypertension. But then how does pulmonary hypertension happen, right? So why would there be pulmonary hypertension? So some things to keep in mind is if someone has COPD, right, or some sort of lung disease, okay, or so basically any sort of obstructive or restrictive lung disease, right? We know that low oxygen in the lungs will cause vasoconstriction, right? And then that's going to lead to a higher pressure, right, in your lungs due to the widespread vasoconstriction of your capillaries. So that means your right ventricle is going to have to work much harder to pump blood into the lungs, right? Because if all the capillaries, all the blood vessels are vasoconstricted, that's going to increase the pressure a lot in your lungs. And so your right ventricle is going to have to work that much harder to work to pump past that high pressure environment, right? So it can get blood into the lungs. So then the only option your right ventricle is going to have is to hypertrophy, and then that's going to later lead to dilation of your ventricles, which will then lead to tricuspid regurgitation. Okay, another reason why you can have pulmonary hypertension is because of left-sided heart failure, right? So if you have left-sided heart failure, which means your left ventricle is not contracting properly anymore, then blood will backflow into your left atrium, into your pulmonary veins, right? And then eventually to your lungs, and then eventually to your pulmonary artery, and your right ventricle, right? So that means that, again, if blood is backflowing, your right ventricle is going to have to work that much more harder to push past that increase in pressure, right? So it's going to lead to, again, hypertrophy and dilation, which will lead to tricuspid regurgitation. Okay. And even if there's like pulmonary emboli, right? A pulmonary embolism, right, in your pulmonary artery. So let's say your right ventricle pumps to your pulmonary artery, and your pulmonary artery has a pulmonary embolism, right? A clot like this. So now you only have this much space to pump blood, right? So you just increase the resistance a lot. So that means your right ventricle is going to have to pump that much harder, right, to push past this clot. And so your right ventricle is going to have to hypertrophy, and later that can lead to dilation and a weak right ventricle, right? Which will lead to, again, tricuspid regurgitation. All right. So, I mean, what's another reason that the right ventricle can be dilated, right? So, pulmonary hypertension makes sense. But what about if you have a heart attack, right? A myocardial infarction, and you knock out a big chunk of muscle in the right ventricle? Okay. So, how is that going to lead to dilation? Right? So if you have a heart attack, right, let's say of your right coronary artery or some small branch that, right, that gets clotted, that or a clot forms due to a cholesterol plaque or something rupturing, right, and you knock out this portion of the myocardium of your right ventricle, then eventually, right, we know that granulation tissue will form and fibrosis will occur, and that's going to weaken the wall of the tissue of the heart tissue, right, of the myocardium, and that can lead to dilation, right? And if that leads to dilation, again, what's that going to lead to? Your leaflets spreading apart, and therefore they're not going to be able to co-opt together during systole, and that's going to lead to tricuspid regurgitation or backflow of blood from the right ventricle to the right atrium. Okay. Um, and even cardiomyopathy, right, can lead to dilation of the heart, which can, so like what things can cause dilated cardiomyopathy? Right? So for example, the Coxsackie B virus, or even like cocaine use, right? Or uh, severe alcohol use can dilate the heart, and that can lead to regurgitation, right? So there's many causes of cardiomyopathy, but just know that cardiomyopathy is one of the types is dilated cardiomyopathy, and that can lead to it's in the name, right? So your ventricles can get really big and globular, which will then, like we talked about, spread the leaflets apart of the tricuspid valve and then lead to regurgitation because the tricuspid valve then won't be able to co-opt and close together during systole. All right. So that's another way that your right ventricle can dilate. All right. And another way that we can talk about it, that's important to include, is if you had like mitral regurgitation, for example, right? So this is on the left side of your heart. Okay. If you had mitral regurgitation where your mitral valve isn't closing properly, then you can imagine every time the left ventricle contracts at a high pressure, right? It's going to squeeze blood back to the left atrium every time. Eventually, that blood can backflow, right? And affect the right side of the heart, just like we talked about in left heart failure, right? And if blood is backflowing like that, then you're increasing the pressure in your pulmonary circulation, which means your right ventricle now will have to work even harder to push past that pressure and push blood into the lungs, right? So then your right ventricle is gonna hypertrophy and dilate and then lead to tricuspid regurgitation. Okay, so this is all these causes that we're talking about is a problem with the heart wall, right? With the right ventricle itself, not the valve, not the tricuspid valve. So then what if we talk about primary causes, right? Things that will affect the valve itself. Okay. So one cause we can talk about that's pretty important to know is infective endocarditis. Okay, so let's write that down. Infective endocarditis, right? And this is going to be a whole separate video because there are tons of pathogens that can cause this. Okay, but the end result is that you get the main thing that we have to talk about is you get these vegetations, right? So these vegetations are basically made up of like fibrin, and bacteria, right? And even platelets. So these are the vegetations that basically adheres to the valve, okay? And so if they stick onto these valves, right? And then on top of that, you get bacteria that stick onto these vegetations, right? So now you get these infected vegetations, and then that can lead to erosion of the valve, okay? So you can imagine, right? If bacteria, platelets, fibrin, right? If all these form vegetations on the valve, so if we just draw a big valve like this, let's say this is a tricuspid valve, and you have all of these vegetations, right? Then that can start to destroy the valve, right? So if that destroys the valve, then this you can imagine that a destroyed valve won't be able to function properly, right? Which means it won't be able to close properly, and it's going to let blood backflow into the right atrium from the right ventricle, right? So that's infective endocarditis. And that, I mean, that's why infective endocarditis can cause regurgitation, right? You get these vegetations, right? These bacterial vegetations, and then that will destroy the valve. Destroyed valves don't work properly, right? So then the tricuspid valve won't be able to close properly during systole, and blood will backflow from the right ventricle to the right atrium. Okay. And for example, like this can, I mean, infective endocarditis, a really big cause of this can be IV drug abuse, right? IV drug use, especially with like dirty needles, right? So, like, for example, Staph aureus. Staph aureus doesn't even need vegetations. It can directly come when it can directly affect the valve by destroying it, right? But yeah, certain pathogens that you get from dirty needle use or needle sharing, right, can get directly into your circulation, come to your valves, because it hits your tricuspid valve first, right? That's the first valve in the right side of your heart. And then it can cause erosion of the valve, destroy the valve, and then your valves won't work properly, leading to regurgitation. And we'll talk about infective endocarditis, all the causes, all the pathogens, all the findings, like all the septic emboli findings, the immune complex findings, and everything in a separate video. All right, but that's the main way that infective endocarditis can lead to tricuspid regurgitation. Another cause that we should be mentioning is carcinoid syndrome. All right, carcinoid syndrome. So certain tumors, right? Certain tumors can release things like serotonin. All right. And serotonin, when it comes in contact with your valves of the heart, it can lead to fibrosis. And so if you have fibrosis of your valves, right? Again, that's not going to, those fibrosed valves are not going to work properly, right? And so if they don't work properly, that means they won't be able to close properly when your right ventricle contracts. So that's going to lead to regurgitation, okay? And something we can talk about relating to carcinoid syndrome is that you don't always get symptoms, right? So, for example, if you have a tumor in your GI tract and that tumor is releasing serotonin, right? That serotonin will then go to your portal circulation, right? And then from your portal circulation, it's going to go to your liver, right? And your liver has an enzyme called monoamine oxidase. And monoamine oxidase metabolizes serotonin, right? And so if serotonin gets destroyed in your liver, right, it's not going to make it out to your circulation, so you won't get those symptoms of serotonin syndrome, which is like flushing, bronchoconstriction, abdominal pain, right? All those things. You won't get those symptoms. But and similarly, right, you can imagine like, okay, if the right side of the heart, right, if serotonin comes in contact with the valves present on the right side of your heart, like your tricuspid valve and pulmonary valve, why don't you get fibrosis on the left side of your heart? Well, because when that serotonin, right? So as we said, it goes to your tricuspid valve, and let's say once it reaches there, it causes fibrosis of your tricuspid valve, leading to regurgitation. Then that serotonin will then make its way to the lungs, right? And in your lungs, you also have monoamine oxidase. So you destroy that serotonin before it gets to the left side of your heart, Okay, so that's why you don't see those serotonin effects on the valves on the left side of your heart because it gets destroyed in your lungs. All right, because you had that monoamine oxidase enzyme in your lungs. But that's the reason why carcinoid syndrome can also cause regurgitation. Okay, so let's keep on going with our different causes. So another cause, right, of tricuspid valve regurgitation can be rheumatic heart disease, right? Even though it's more common for the mitral valve to be affected, but the tricuspid valve can be affected too. Okay, and we know rheumatic heart disease is because of the Streptococcus pyogenes, right? Group A, pathogen, right? That's going to cause that molecular mimicry reaction, and we'll talk about this in a separate video. But what basically happens is you get that strep throat with that strep pyogenes pathogen, and your immune system makes antibodies, right, against this, but these antibodies also go and attack tissues that look similar to this antigen, right? One of those tissues being the heart, okay? And in the heart, if it attacks your valves, right, it can cause inflammation, destruction, fibrosis of your valves, again leading to regurgitation, right? Because you're going to have valves that don't work properly. And this can even later on lead to stenosis too. Okay. Another cause of tricuspid valve regurgitation is something called Epstein anomaly. All right. Epstein anomaly. And this is congenital. Okay. It's important to note this is congenital. Now, what is Epstein anomaly? Right? So instead of normal tricuspid valves, right, where you have normal valves like this, what happens is you have something like this, where your tricuspid valves actually extend all the way downward, right, deep into your right ventricle. So you atrialize your right ventricle, right? Because if your tricuspid valves are that that much bigger and extend all the way down to your right ventricle, then it's not going to be able to close properly, right? And so whenever your right ventricle contracts, it's not going to be able to close properly. Therefore, that means that blood will backflow into your right atrium. Right. So basically, in this disease, right, in Epstein's anomaly, in this condition, because the tricuspid valve is displaced so down, like is displaced downward and deep into the right ventricle, this puts the tricuspid valve in an abnormal position, okay, in which when the right ventricle contracts, it cannot close properly, okay, because it's not in its normal position, right? And so if it cannot close properly, blood will go back to the right atrium, therefore leading to tricuspid regurgitation, and right atrial dilation, increased right atrial pressure, backflow into your jugular vein, your liver, your your legs, right, leading to edema and all the findings we talked about there, right? So, so that's why that makes sense, right? To see those findings. Okay, so your right atrium will get volume overloaded, right? Because every time your right ventricle contracts, it pushes blood up to your right atrium, and then eventually that blood will backflow, okay, causing right atrial dilation, JVD, hepatomegaly edema, cyanosis even, right? Because we said that the right ventricle is supposed to pump its deoxygenated blood into the lungs so that that blood can get oxygenated, go to your left side of your heart, and then pump, and so that your left side of your heart can pump that blood, that oxygenated blood to your body. But if you're pumping a lot of that blood, that deoxygenated blood that's supposed to get oxygenated back into your right atrium, then that means you're not pumping as much blood then effectively to your lungs, which means not much blood. That means less oxygenated blood is coming to the left ventricle eventually, right? And then less oxygenated blood is making it out to your body, right? So that can lead to low oxygen delivery to your organs. Okay. Something else that we should keep in mind is this Epstein anomaly condition is associated with Wolff-Parkinson's White syndrome. Okay. And remember, Wolff-Parkinson's White syndrome is when you have that bundle of Kent, right? That we talked about right over here. It's just it's tissue that can transmit electrical impulses, right? So then if you have some sort of PAC, right, and that fires, then it can actually travel down your bundle of Kent into your left ventricle and fire left ventricle quick, right? Faster than your AV node allows signals. Okay. And that can be dangerous is because if you have ton of these PACs, right? Or imagine if you have atrial fibrillation, right? And you're having a lot of reentry, and that reentry can just travel right down your bundle of Kent and stimulate your left ventricle, right? That could lead to dangerous rhythms and arrhythmias. Okay. Well, and we'll talk about Wolf Parkinson's White syndrome in another video in our arrhythmia playlist. Okay. But I hope I hope it makes sense as to why Epstein anomaly leads to regurgitation. Okay. And those are the main causes actually. So we talked about all the main causes. And so the next thing to talk about is going to be like, how do we treat this, right? So for common things like heart failure, right? Left-sided heart failure, and things like that, like you try to do the normal heart failure treatment, right? So beta blockers, you try to reduce congestion via diuretics, you would try to give like ACE inhibitors or angiotensin receptor blockers, right? Things like that, the normal conventional heart failure treatment. Okay. So that way you can reduce some of that backflow into your lungs and reduce the edema, reduce the congestion, right? So ease the right ventricle a little bit so that it doesn't keep on it doesn't continue to hypertrophy and dilate, right? If it's endocarditis, for example, antibiotics would help, right? Especially if it's a nasty pathogen that's destroying the valve. And yeah, so if it's too bad, right, you can a valve replacement could be an option too. All right. So that's the main things to keep in mind when talking about treatment, okay, of tricuspid valve regurgitation. And you can do so like how would you find this out? You can do an echocardiogram, right? And you can see that blood flow going backwards, right? Instead of going from the right ventricle to the instead of blood going from the right ventricle to the pulmonary artery, you would see that blood going backwards into the right atrium instead. Okay. Um, but that's basically tricuspid regurgitation. I hope this wasn't too confusing. I hope this helped. Thank you guys for watching and see you guys in my future videos.